you ever watched as a nurse is giving you an injection? Or have you ever had to give an injection to yourself? Maybe you know a loved one who has to give themselves injections on a daily basis, or maybe the thought of a needle makes you a little bit queasy. Today, I'm going to show you the proper technique of giving an injection. This may be done by your healthcare provider, a nurse, or even by yourself. It is important to know the proper technique of giving an injection in case you or a loved one is ever faced with a situation where you need to be injected. A few months ago, I was a nursing student at GCC. I learned how to give an injection. At first, the thought of sticking someone with a needle scared me, but with practice, I felt more comfortable with it. Some people may think that giving someone a shot is just as easy as sticking someone with a needle. However, there are some important steps behind it for the safety of you and the patient. I have with me today some important supplies. I'm going to pretend today that this orange is my patient. Instead of demonstrating on a person, I'm going to use this orange. I have with me the medication, some alcohol pads, an injection, and some gloves. Now the first step that we're going to do is wash our hands, but since I do not have a sink with me, and for time's sake, I'm just going to pretend like I just washed them. I just washed my hands. The next thing that we're going to do is get our medication. And I'm going to get one of these alcohol swabs out. And I'm just going to wipe off the top of this. I'm just going to set this over here to dry. Now the next thing I'm going to do, get my syringe. Now you want to make sure that this is not opened in any way, because you do not want to cause any kind of infection to your patient, so you want it to be brand new. This is new, so I'm going to open it. Just going to set this over here. Now I'm going to demonstrate first how to give an intramuscular injection. This is where it's injected directly into a muscle, which you can use it right here, or even the front of the thigh as a place that you can use it. And some types of intramuscular injections would be a vaccine or an epinephrine shot. So I have this right here. I have my needle, and I'm going to slowly draw up 1 milliliter of air. And if you can see this, it says milliliter right here on the side, and each one of these lines is 0.1 milliliter. And I'm going to pretend like the doctor ordered for 1 milliliter of air. So I just put this, well, 1 milliliter medicine, but you have to inject the air into this vial first. So I'm going to inject the air into the medication. And the reason why we do this is because if you don't, it can create a sort of a vacuum, which if you don't inject air first, it can be hard to draw up the medication. So after I inject the air into the vial, I'm then going to tip up this, and I'm just going to slowly draw up the 1 milliliter of air, of medication. I have it right there. Now if there's any bubbles in here, you just want to tap the side of it. Click it. You can use a pen for this or a pencil too. But you don't want there to be any bubbles when you inject it into the patient. So that looks good. I'm just going to bring this out like this. And you do not want to stick this like this because you might stick yourself. So instead I'm going to put it on a flat surface and then just bring it in like this. And one more final check before I inject it into the patient. I'm just going to do a downward motion and pick it up to make sure that there's no bubbles. I don't see any. I'm going to set this down right here. I'm going to put on my gloves. The reason why I do this is because sometimes injecting somebody with a needle can make them bleed, and you don't want to get any blood on yourself. So I'm going to put on my gloves. I'm going to get one more alcohol pad, and I'm just going to use a circular motion from the inside out, and I'm just going to wipe the patient. And I'm just going to allow this to dry a little bit. And then I'm going to remove my cap from my needle. And for intramuscular injection, you want to spread this like this. Spread the skin. You want to go in at a 90-degree angle. And we're just going to inject it. See how I have my hand stabilized? You want to make sure you have your hand stabilized so the needle doesn't move at all. And I'm just going to slowly push down the plunger. And then I'm going to take this alcohol pad and hold it right here and apply some pressure as I'm removing the needle. That is how you give an intramuscular injection. Now I'm going to show you how to do another kind of injection. It's called a subcutaneous injection. This can be injected into the folds around the stomach area, or it can be used in the back of the arm. There are also some other areas you can put this. This needle will be a little bit shorter because we're not injecting it into the muscle, but instead we're going to inject it just into the skin. So to save time today, I already drew up my medication that I needed, and we're just going to pretend like I already put the alcohol pad on it and we already did all those steps. I'm just going to set this to the side. Instead of spreading the skin, since we're just going to inject it in the skin, I'm just going to pinch the skin up. It's still at the 90-degree angle, and I'm going to inject it. And this one, stabilize your hand, and you're just going to push the plunger down. Pull it out. My needle quick. You want to dispose of these in a proper container. I'm going to remove my gloves, and then I would wash my hands. I just taught you the proper technique of giving an intramuscular injection and a subcutaneous injection. I went over the proper steps of washing my hands, also drawing up the right amount of medication, preparing the patient by cleaning the area, and also injecting properly. I hope you find this helpful in case you are faced with a situation where you or a loved one or someone that you know ever has to have injections or be injected.